Let's have this discussion now. The South African Paediatric Association has met to discuss the COVID-19 vaccination rollout for teachers, which is currently underway in some parts of the country. In fact, Basic Education Minister Angie Motshekga, we are told, has arrived at the Rabasotho community hall that's in Tembisa. We're expecting her to oversee that leg of the inspection. Now, this particular association, which advances the rights of children, says new evidence has emerged showing that primary school pupils are not super spreaders of the virus. Get you a better sense of what they found. President of the association is Professor Mignon McCulloch. She joins us now via our video link. Prof, great to see you. Thanks very much indeed for making time. We were always told that we need to think quite differently about COVID-19, especially because of the so-called beta variant found in South Africa. We're told that that variant responds very differently to children. What are you finding?
So thank you very much for having me on your show. And I think the important thing here is the balance between COVID fatigue and the third wave that we're in the middle of at the moment. And we've always tried to be rational and have evidence-based information to share with the public. And so the NICD, National Institute of Communicable Diseases, was part of a meeting yesterday with the Ministerial Advisory Committee and ourselves. And it's showing that there's actually still very little spread from children under the age of 15. Also, no relationship in increased infection between the opening and closing of schools, which I think is really important, because what's happening now is that there's been up to 54% reduction in contact time for children and for learners, at least at primary school level, which means we're going to be seeing these after effects 10 years from now, when children are going to be way behind in their school performance. So we get that people are anxious. We really do. We get that teachers are anxious. So we're very excited about the vaccine rollout. We think it's great. We are concerned that there are some people with vaccine hesitancy, and we want to say, go out there, go and get your jab, and then let's get kids and teachers back into the classroom. Let's keep them there, because in many ways, schools are controlled environments. Children and teachers wear their masks. They're hand sanitized, and even if the distance isn't quite as far as we'd like it to be, at least it's a controlled environment. What we're seeing and what we're hearing from school teachers is the minute the children leave the classrooms, go out the gate, all the masks are dropped. And so the spreading we're seeing is happening at community level. And we now have got studies that have happened in South Africa, a good study in Clarksville, showing that children are not the super spreaders. They may get infected, yes, but they are not actually, they are getting it from adults, as we've said all along. They are not passing it on to adults on the whole. The adults are getting it in the community when they are not safe, when their masks are down. And we are very worried about school performance. When you've got 54% loss of contact time, and they're saying if we continue the rotational process, we may even have a 200% loss of education. So these children are going to suffer in the long run, not the rich kids, the kids who do not have access to online learning. We're also seeing school nutrition has fallen by the wayside. And for specifically girl learners, if they're stuck at home on their own, being cared for by non-parents, often their parents are back at work, they are also at risk for psychological and physical abuse. So, as we said before, let's get everybody back into the classroom in the controlled environment that we know works. We know that masks work. We know that hand sanitizing works. And so those are, we quite relieved that what we've been saying all along has now been proven by South African evidence, specifically in our variant as things stand. And so we're delighted that teachers are being vaccinated. We think it's really great, in the same way as the healthcare workers have mostly all been vaccinated. And if you're feeling nervous about the vaccine, don't be. Let's get it into people, and let's try and get back to some sort of normality for our children, because otherwise we are going to be paying the price for this in years to come. We're looking at even 10 years' time. The grade 12 children of 10 years' time are going to be way behind in their studies, and we can't afford to have that as a country that's trying to move forward and do good things for their learners.
Just out of interest, Prof, and perhaps if you can respond to this in layman's terms, how do you track who is spreading the virus? I mean, all we can really do is, I guess, find out who's contracted it, but how are you able to distinguish whether, for instance, it's a child or an adult that's passed the virus on? I'm not sure if I'm making sense.
Yeah, you're making absolute sense, and it's a very good question. So Professor Cheryl Cohen from the NICD, she's an epidemiologist, have done a study in Klerksdorp where they've actually looked at asymptomatic and symptomatic families, the entire family. They've actually swabbed them, and they've actually seen that on the whole the children are not bringing the virus into the homes. It's mainly the adults. Yes, children can get it. Less than 10% of the total group of the population are children under the age of 15. And these children on the whole don't actually have an increase in admission rate, so we're not putting our children at risk, which is a question that we often asked. And so when we've swabbed them, when we've done studies, it's mainly the adults that are spreading rather than the children. The children on the whole, this is not a children's virus like measles or RSV or the other viruses that we know well. This is a virus that affects mainly adults. And if the children are affected, they will be affected in a mild manner and they will not be spreading it as much on the whole. And so we're saying let's be rational about it. We now have some evidence from South African studies, which is very exciting, but it does mirror what's happening in the rest of the world. So this is a community virus that is spread when people have COVID fatigue. They drop their masks, they eat in public, they have small closed spaces, specifically in the winter, whereas schools on the whole are actually finding they're actually safer places than the community and the environment around us.
Yeah. What is important, of course, to drive home is that that doesn't change anything about how we should be responding to the virus, even within schools, because I think sometimes what is lost to many ordinary people is that getting vaccinated doesn't mean you don't stop spreading the virus in and of itself. Yeah. Help us understand then what this should mean for behavior, even among vaccinated teachers in schools.
So in the same way as healthcare workers who have now on the whole all been vaccinated, we are still wearing masks, we are still hand sanitizing, we are not sitting in crowded places, crowded tea rooms. So the teachers and the pupils will need to continue to wear their masks and to hand sanitize and remain as socially distanced as is possible. So this is just trying to prevent the spread of the virus in our communities. But it's a start, and it's the only way we're actually going to get over this pandemic. And so the Ministerial Advisory Committee is putting a lot of work with a lot of experts from various health authorities and the National Institute of Communicable Diseases, ourselves, and a lot of people that have children's interest at heart, but at the same time also being concerned about the community.
Professor Mignon McCulloch, let me thank you for your time. Really appreciate your speaking to us. She's the president of SAPRA.